8, sorry, Professor. 8.
Okay, so from where do you know this about 8?
The asnaf of zakat.
Yeah,
The
okay,
one, the
that's
people
good.
that can give zakat.
Okay, so from where? From where you have come to know about this asnaf of zakat?
From the hadith.
From the hadith? Is there any other way to know about them? What about Surah At-Tawbah, verse number 60?
Oh.
Please note down this, Surah At-Tawbah, verse number 60. That this is actually, assuming that these things actually you know, and for that's why you are leaving behind and focusing more on other things. But these are the basics actually you need to know. Second comment on, please go to your scenario number 1. How you deal your scenario number 1, the slides. The presenter, please go to the scenario number 1.
So we share the.
Please share the. Where is the presentations? Presentation slide. Can I have the presentation slide? Yeah, go to scenario number 1.
Scenario number 1.
Yeah, go back to the slide number, scenario number. Here. Okay, so go to the next slide. Here, as you find out the methodology of whether he should take the money or not, as what I have understood, the situation, you supposed to rectify whether he falls under the 8 asnaf of zakat or not. That's the first methodology one supposed to follow. You need to understand, or we need to understand, the differences between zakat and sadaqah or waqaf. We can give money to anyone, sadaqah to anyone. But when it comes to zakat, first of all, we need to identify the 8 people to whom we should give and how much we should calculate. So these are the basic things. Actually, when we are giving you to prepare these kind of preparations or presentations, we would expect that these definitions or our basic understanding you will represent to us, whether to know that you are aware of the basic, what is zakat, what is salah. If we do not know the basics and move forward to the second level, actually there will be a grave misunderstanding will be in the field of work. So please do note this about the asnaful zakat, the words that I just now said, Surah At-Tawbah verse number 60, and also the methodology of performing zakat and giving zakat, and what are the differences between zakat, waqaf, income tax, sadaqah. Okay, I think the supervisor of this group, I think Dr. Farhan, he would be most important person to take these comments and accommodate that later in the learning period. Thank you for your presentations.
Okay, thank you very much, Dr. Nazmus, for the input regarding the basic thing about zakat first. Then, when either the person or patient can take zakat or can either choose wakaf. Okay, thank you very much. Thank you once again to the group 3 for the beautiful presentation. So thank you very much. So I would like to invite, we go straight to the fourth group, the group 4. So group 4 under supervisor Dr. Mbaya will describe more on communication, and there will be some of the case scenario that we'll discuss regarding this communication. So I'd like to invite group 4 for the presentation.
Hello, good afternoon. I'm Gita here. I'll be representing group 4. So I will share my screen first. Okay, it's in slideshow. Can everyone see my slides?
Okay, nice.
Can. Okay, so my group have been given the task regarding communication. So the first part would be regarding the definition, types, and importance in life and work. So firstly, a bit of introduction. So communication is the process of exchanging information, ideas, thought, feelings, and messages between individual or groups. And it involves a sender, a message, a medium, and a receiver. It can occur through various channels, through spoken words, written text, non-verbal cues, or digital media. So there are several types of communication. The first is verbal, where we use spoken language to convey message. Non-verbal, where we use body language to convey message. Written, where we use written language. And lastly, visual, where we use imaginary to convey the message. So communication in an Islamic perspective, in Islam, communication is guided by principles rooted in the teaching of the Quran and Hadith. Islam has established guidelines and principles in interpretation of communication, including through greetings, soft talk, using good words, speaking truth, and keeping promise. So this is the framework for the Islamic-based art of communication. So the source of the knowledge for art of communication in Islam is from the Al-Quran and Hadith, and they consist of the adab of the communicator, the content of the communication, and communication etiquette. And this forms the art of communication in Islam. Next is the importance of communication in life and work. So firstly, in life, it is important in building and maintaining relationship. So it is essential to have good communication in enforcing trust and understanding in relationship between family, friends, and partners. So it helps to resolve conflicts and misunderstanding and strengthens the bond between family members, friends, and partners. Secondly, in expressing needs and desires, clear communication allows individuals to express their needs, desires, and emotions effectively and ensure that others understand and can respond appropriately. And thirdly, for personal development, so effective communication skill enhance self-awareness and emotional intelligence, and they contribute to personal growth by enabling better interaction and understanding of others. And lastly, for problem solving, communication is key to discussing and solving personal issues. It helps in seeking advice, support, and collaborating with others to find solutions. And next, importance of communication in work. Firstly, for professional relationship. So a strong communication is essential in helping building professional relationship and networks. They are crucial for teamwork, collaboration, and maintaining a positive work environment. Secondly, for career advancement, effective communicators are often seen as leaders and are more likely to advance in their careers. They can articulate ideas clearly, encourage others, and present themselves confidently. Thirdly, for efficiency and productivity, clear communication reduces misunderstandings and errors, enhancing efficiency and productivity. It ensures that the tasks are understood and completed correctly. And finally, good communication is essential for conflict resolution. Next, moving on to the second part of the presentation, which is the first scenario. So I will pass on to my groupmate.
Good afternoon. I'm Jagan. So I would like to talk about a case scenario. You will realize that sometimes it's difficult to refer a case from a district to a tertiary center or from one department to another department. So some doctors in one department might feel superior and look down on other departments, therefore always argue with other colleagues in different departments where they would like to refer a case. So how do we improve this referral culture to be more harmonious without any miscommunication? Next. Next, please. Okay, in the Muslim study, there's two ways of saying this, Hadith 1 and Hadith 2. So Hadith 1, basically they are talking about peace and blessing, where we shouldn't insult or and talk friendly to others. We should not, he should not be one of us, should not be friend with anyone else. Next. So communication in structured manner. So one of the tools of effective communication is called ISPA in the Islamic studies. So we need the identity, we need to know the identity. So example, the person is referring, so we need to know the name, their position, then speak to the correct person in charge. Then you have to tell the patient's name, the details, ward, and etc. Also have to tell them the past medical history and the current medical situation. And also have to define to them the clinical assessment. So with that, they will request you tertiary from the tertiary center what proper management advice and clinical advice to them. Next. So we always be practicing a positive attitude. So attitude, by installing a positive attitude when communication is encouraged in Islam. So vulgar words is really not encouraged, where Allah does not like public mention of evil except the one who has been wronged and ever is Allah hearing and knowing. So nice words should be used more. Speak more softly. Body language is very important. So when you meet any other doctors, other referring doctors, always show good showing smiling face. Always the Prophet Muhammad always express their cheerful facial expression while meeting or passing by other people, apart when he saw someone committing wrongdoing. Next. Okay, instill cooperation and teamwork. And this is the very important thing. We need to aim to achieve the highest level of care of patients. So teamwork is very important. So I think there's a quote here: cooperate with one another is goodness and righteousness of do not cooperate in sin and transgression. And be mindful of Allah, sure Allah is severe in punishment. Next. So always ensure mutual respect and honor. So why are they differing to us? Because they want an expert opinion from the other team, especially from district to tertiary or other departments for their expertise. So that's the reason they are referring to other people. Should always be polite. Polite, treat people with courtesy, politeness, and kindness. If you disagree with their management or their plan or their purpose or referral, always tell them in a calm way. Do not criticize them. Next. Okay, so most importantly, it must be effective, right, and target. So when you communicate with other people, so you must be communicating in the style of speech must be, and pass on message should be adjusted level of intellectually, and the mass of use and language that can be understood by the other people. That's the most important, because it's been stated here, those the ones of whom Allah knows what is their hearts, so turn away from them, but admonish them and speak to them a far-reaching word. Next. As we all know, all our knowledge is from God. So receiving a referral basically is sharing knowledge and expertise. All these are given by God. So at time, our knowledge will be taken back. Next. Most importantly, when you're receiving a referral, we must be an active listener. You must understand when receiving a referral from a district hospital or clinical center, you have to understand their limitation, their center. They don't have all the facilities like the tertiary centers. So it's very important. In Quran recited that, then listen to it and pay attention, you may receive mercy. Okay, next. We'll pass over the next presenter for the next question.
Okay, good afternoon. I'm Leo, and I'll be discussing on the second scenario here. The scenario is a patient requests for an antibiotics for his viral tonsillitis. You have informed the patient that it is not indicated. However, the patient still insists for it. So how do we resolve this issue? So this is a very common situation that we face in our daily practice, whereby the patient doesn't understand or agree with our counseling or decision. And in the teaching of Islam, there's multiple teachings and principles that can be that can be used to guide us in how do we counsel and communicate with the patient. So first is the concept of Rama, which is compassion and empathy. So here it is important for us to show kindness and understanding towards the patient's concerns and fears. As the Prophet Muhammad, peace be upon him, emphasized the importance of compassion, saying that he who does not show mercy to our young ones and does not acknowledge the rights of our elders is not one of us. So here it is important for us to understand the fear and concern of the patients. We must understand that they are in a vulnerable state, they are in a stressed environment, and sometimes they might not understand what we are trying to say. Then next, we'll move on to the concept of hikmah, which is the wisdom and good counsel. So here, when we try to communicate with the patient, we should try to explain in why the antibiotics are not suitable for the viral infection. Here, as my friend stated previously, we should use polite words. We shouldn't be condescending, shouldn't be insulting. We should try to explain to them in a understandable manner that why antibiotics is not suitable. So as the Quran stated, invite to the way of our Lord, of your Lord, with wisdom and good instruction, and argue with them in a way that is best. Then next, we have the concept of Sikh and Amanah, which is honesty and integrity. So during our conversation and communication with the patient, we must always be honest with them and maintain our integrity. So in the context of this scenario, we should be honest with them about why is the antibiotics not effective for tonsillitis, and what is the potential complications or harm that can be caused by unnecessary antibiotic usage. And throughout our communication, as stated, honesty is fundamental. Then next is the concept of IIMP, which is education or knowledge. So here, as Prophet Muhammad stated, seeking knowledge is an obligation upon every Muslim. So here we should try to educate and explain to the patient so that they come to understanding and they understand why we make such decision for them. And after the discussion, next, it is the concept of shura, which is consultation and shared decision making. So I think this is in common with the practice that is being recommended in that we are advised to involve the patient in the decision making process and also consider their preference and any concerns. So as the Quran mentioned, the importance of consultation, and those who have responded to their Lord and established prayer and whose affair is determined by consultation amongst themselves, and from what we have provided them, they spend. And I think ultimately the most important thing that we have to emphasize is the concept of tawakkul, which is the trust in divine guidance. So here, as Prophet Muhammad said, tie your camel and trust in Allah. So here we have to remind the patient that what we are a tool that Allah has given for us to help cure the patient. We are the tool that is there to help, and ultimately the trust in Allah would be the cure for the patient. And lastly, with all those being said, there should be a proper documentation about the discussion and the education provided. So with that, I think I conclude our presentation today, and I will, thank you.
Yeah, thank you, Gopal, for the nice presentation. So I'd like to invite our expert panel to comment. I do want Dr. Nazmus or Dr. Prof. Ibrahim want to comment first.
Yeah, presentation is. Oh, Dr. Nazmus, come in.
No. You first, Prof.
Okay. In all cases, thank you very much. Presentation as well, and the topic is very useful, even though it is a little bit broad, because when you say just communication, because communication today is one of the objectives of the education as whole. In the globalization time, effective communication, that is ability to spell your views and also to listen to others is one of the most required education purposes. But in a specific area like medical, when you say communication, then the stakeholders are so many. So you need to narrow down, at least maybe communication with the patient. What is a way to communicate with the patient? Otherwise, communication with your colleagues, communication with the suppliers, communication with the mass people and your patients, and so on. So this will come into mind. Principles, you mentioned about the scenario very well, I believe. Of course, if you just mention few of them and then show us how you apply. For example, you mentioned hikmah, because this guy is or this patient insisting to take a specific kind of medicine, but as you are a medical doctor, you know also what is the danger should be. So you want to convince the person not to take. So maybe you need one of or few of these principles which you mentioned. Maybe here is hikmah is the most important. Hikmah is to be to have wisdom to convince a person without conflict with you. Also, maybe the issue of shura, and I think you spell it very well. That means you need to discuss with the patient. Patient-centered medical issue today becoming very important. That means the medical, the patient can play a role in the process of medication. He has a decision or he has a word to say. So you can do consultation with him, but still you use wisdom not to give something which is going to be harming to him. Okay. So what I mean is presentation is okay. I don't want to close the door to our brother, Dr. Nesmus. Maybe he has some comments to say. Thank you.
Thank you, Ibrahim. Dr. Nesmus.
Thank you. Thank you for the wonderful presentations. As long as Malaysia is a multicultural society, and as your first scenario is related to about colleagues and different patients, is there anyone from the group who can tell me the methodology you will apply in order to settle a misunderstanding between non-Muslims or Muslim doctor, non-Muslim patients, or non-Muslim doctor, Muslim patients? What are the methodologies you would like to apply in order to eradicate the misunderstanding between the religious differences? Your first scenario. Case scenario, you realize that it is always difficult to refer a case from the district to the territory center. This case, so I just added it's a dispute between two religious authorities. So how would you would like to solve the case, and through which methodology?
Group 4, anyone? Or you want to ask further the question if you don't understand? Group 4? Anyone?
Hi, Assalamualaikum.
Hmm.
Okay, I think regarding the scenario, which is the is regarding the referral from different center, but what the question is now at is regarding if it's in between people with different religion, right? Is that correct?
Yes, yes.
Okay, so because everyone have their belief, different regions have their own belief. So it is important to understand, to try to understand and engage in other people, religion, culture, and belief. And we must back to the principle that we should treat all people with respect and dignity. And other than that, we should try to identify the common ground, because the referral that has been made is mainly for patients' benefit. And whatever we are doing, regardless of any religion, we have to prioritize our patients' need and care. Other than that, I think that's all I can think for now.
Okay, thank you. In order to just to add, I would like to refer Surah Al-Mumtahina. You can write it down. Surah Al-Mumtahina, verse number 8, and Surah An-Nisa, verse number 64. These are the two verses where we can go for how to treat like from religious perspective to each other. Chapter 3, Surah Al-Imran, that is verse number 64. Kulliyyah of Kitab, Ta'alaw ila kalimatin sawa. This one, and Surah Al-Mumtahina, verse number 8. La yanhakumullah anil lazina lam yuqatiluna fid din. So these two are kind of the methodologies we're supposed to follow in order to facilitate among religious diversity. So you may have a look on that two verses and have a ponder when it comes to work ethics. Thank you.
Yeah, thank you, Dr. Nazmus. For Razak, any sharing? Want to share or any question?
No, I think I enjoy listening to them. I enjoy it, especially when they mention that as a medical professional they need to take care of the communication, especially now they are offering medical services to a multicultural society. So I think it's good to be aware the cultural sensitivities that exist among patients, especially when it comes to, let us say, physical communication. Some cultures, they don't like the medical doctor to touch their body, especially during examination. Then some cultures, probably they don't want the doctor to have some kind of like, how do you say, touching the hair, they have sensitivities. Some cultures, they always, prefer, a male doctor to be treating a male patient. And then female patient to be treated by a female doctor. It's like, I think when you're at the hospital now, you are living in a globalized center where you're meeting a different culture. So I think communication plays an essential role, especially when you want to convey the message, to the patient, especially when now you guys may be involved after graduation, you may be involved in what they call telehealthy, right? Telehealthy. So sometimes you need translators, juru bahasa, and sometimes the meaning are missed somewhere in the translations. Maybe your instructions as a medical doctor are not conveyed properly to the patient. So I think those areas need to be, taken care. Other than that, I think the presentation was okay. Thank you.
Thank you, Prof. Razak. Okay, thank you once again to all for group 4 for the excellent presentation, and hopefully we get some benefits. Okay, thank you very much. Okay, so okay, we go to next our presentation to the group 5. I think this also regarding the communication. think it's more on patient or breaking news or patient doctor-patient communication. So I would like to invite the group 5 for the presentation.
Assalamualaikum and good afternoon, everyone. Can you all hear me?
Boleh.
Hello?
Okay.
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 So my name is Notilawatu from Group 5. Our group is supervised by Mr. Hamzah and Mr. Irfan. In this session, our group was given a task to present on the tips to inform result to the patient effectively, and also we have 3 case scenario for discussion. So I will present topic 1, which is list tips to inform patient effectively, to inform result to patient effectively. So there are few practical tips that can be used during the session. The first is to prepare the environment. We need to choose a quiet and private place to discuss the result. We need to use clear language, need to avoid medical jargon and use simple, clear language that the patient can understand. Be present. We have to maintain the eye contact with patient, listen actively, ensure that we are fully present during the conversation, and follow up the patient, offer additional resources, follow-up appointment or support service to help the patient to cope with the news. By incorporating this principle, healthcare provider can ensure that they can communicate a medical result in a manner that is compassionate, ethical, and respectful to the patient belief and values. From Islamic perspective, informing patient about the medical result is a sensitive task that requires empathy, honesty, and professionalism. From the Islamic perspective, several principles can guide healthcare provider in delivering the news effectively, which is honesty and transparency, compassion and empathy, confidentiality, providing hope and encouragement, patience and understanding, cultural sensitivity, and also encouraging trust in God. So in honesty and transparency, we need to be straightforward about the result, ensuring that the patient receive all the necessary information to understand their condition. Compassionate, we need to be compassionate and honest in delivering the news, recognizing the emotional impact it may have on the patient. We need to keep the confidentiality, maintain patient confidentiality, and ensure that sensitive information is shared in a private setting. We need to provide hope and encouragement to the patient, offer reassurance and support, highlighting any positive aspect or step forward, and encourage faith and trust in God's plan. And also need a patience, show patience and understanding. Give the patient time to process the information and be ready to answer their question and address their concern. We need to be aware of the cultural sensitivity, respect the patient's cultural religious background, ensuring that the information is conveyed in a way that aligns with their belief and values. And last, encourage the trust in God. We need to remind patients of the importance of placing trust in Allah's wisdom and mercy, which can be a source of comfort and strength. I will pass to other member for the next case scenario.
Okay, Assalamualaikum and good evening. So I'll be presenting about the case scenario 1. A patient suddenly enters your room and angrily scolding you for a long waiting time. How will you settle this issue? Okay, so next, so in this situation, these are the general things to do lah. So in handling the patient, we have to ensure safety, our safety, the patient safety, and also other people's lah. So patient might engage with become aggressive or holding a weapon. So that's why we have to ensure safety. So and then we have to engage politely in a good manner, and then we have to avoid provocation, and then make sure that everyone else is calm as well lah, all other patient and also all the staff lah. And then we also could ask help from others if needed. And then we have to clarify the issue lah from the patient and also the staff. We start to inquire what is the problem, what is the current issue, what is going on with the patient lah. So we have to sort out the situation as smoothly as possible. And then we have to inform higher authority lah, like our specialist or our pengarah regarding the incident, and also to make refinement to our SOP if needed lah. Okay, so next slide. Okay, so but the main things that I want to emphasize is about ourselves actually. We know that dealing with angry person is not an easy task lah. It will affect us in some ways. So we have to keep patience, which is sabar. We need to control ourselves first by being calm and composed lah. So in this situation, during our conversation with the patient, we have to take a slow or deep breath to keep our mind always open and relaxed lah. And then at the same time, we have to show respect to the patient and to other people, and be humble at the same time. We know that because we are a doctor, that is a patient, we might sometimes think that we darjat lebih tinggi, means that difference in position, so that we might be arrogant. So that's why we must be humble. And then during the conversation, we have to use non-judgmental and non-cynical words. We don't want to further fire up the issue, the patient's emotion lah. Okay, and then we know that actually we can control our own emotion, our own behavior, or our own speech, but we cannot control other people's action or speech or behavior lah. At the end, by being sabar or composed, we have shown a good example as a leader, as a doctor, as a Muslim, and as a person. And then we have to keep reminding ourselves that Allah is always with us, and He will pave the way, and everything happening, there will always be hikmah behind it. Okay, so next. So there's this about patience, narrated Anas. The Prophet Nabi Muhammad sallallahu alaihi wasallam said, the real patient is at the first stroke of calamity. Okay, hadith from Al-Bukhari lah. Okay, so next. So these are the verse from Surah Al-Luqman, verse 17 to 19, in which it mentioned about Luqman advice to the son, to his son lah. At the verse 17, it mentioned about amar ma'ruf nahi munkar, encourage what is good and forbid what is evil, and at the same time, endure patiently what befalls you, what you encounter, what you are facing. And then the next verse mentioned about being humble and do not be arrogant and boastful, and never look down on people lah. And then next verse 19, we have to, during communication, we have to talk softly and polite while talking to others. So so regarding the situation, if we neglect sabar, we might engage the patient in angry mode as well, and then it will further lead to a fight or disaster lah, which is not a good example from other people's point of view. So in summary, be patient in all situations, treat others with humble attitude and also politeness. Okay, so we move on to next case scenario.
I'm Leo from South. So I'm going to discuss on case scenario. So the case scenario is patient.
Sorry. Can't hear.
Yeah. Can you hear me?
Tak dengar.
Sekarang dengar tak? Can you hear me?
Okay, clear.
Yeah, sorry for the technical error. So I'm Liao, I'm from Ophthalm department. So for the second case scenario, is a patient refused a blood transfusion because she was worried that it was a mixture of alcohol from her blood donor that she was going to receive. How to counsel on this? So to answer this, if the person who is to receive the blood transfusion is a person who's life is in danger due to sickness or injury, and the life is depend on his receiving a blood transfusion, then the blood transfusion is not haram in Islam. So next. So there is three matters that concern in blood transfusions. So first is who is the person who is to receive the blood transfusion, and the second is who is the person from whom the blood is to be taken, and the third issue is whom is the person whom we can trust to decide whether a blood transfusion is needed. So for the first issue, who should receive the blood transfusions? So it is stated that he has forbidden you only the matata and blood and the flesh of swine, and that which is slaughtered as a sacrifice for others than Allah. But if one is forced by necessity without willful disobedience nor transgressing the limits, then there is no sin on him, which is stated in Surah Al-Baqarah, chapter 2, verse 173. So next, and regarding this also stated in two different sources. So the first one, but as for him who is forced by severe hunger with no inclination to sin, such can eat these above mentioned meats, then surely Allah is of forgiving, most merciful. And the second is he has to explain to you in detail what is forbidden to you, except under compulsion of necessity. So next. So based on verse of the Quran, if the recovery of the sick or injured person depend on blood transfusion, which he needs to save his life, then there is no other medicine or food that can do the same thing, then it is permissible for him to receive blood transfusion. And for the second issue, whose blood can be taken? So it is stated that the one whom blood is taken, this should not result in any serious harm, because the Prophet said there should be no causing harm nor reciprocating harm. Okay, so next. So for the third issue in this blood transfusion is that who should decide whether a blood transfusion is needed, and this should be a Muslim doctor. And if that is not possible, we see nothing wrong with taking the word of a non-Muslim doctor, whether he is Jewish or Christian, so long as he is experienced in medicine and is trustworthy. So next. So as reported by Al-Bukhari, the principle here is that it's the Sahih Hadith, which describe how the Prophet hired a man of Bani Dil as a skilled and experienced guide, although he was a follower of the pagan religion of Quraysh. So next. So concerning this matter, Al-Kibar Al-Ulama, Council of Senior Scholar, state the following, that it is permissible to donate blood so long as this does not cause any harm and there is a need for it to help other Muslims. And it is permissible to establish Islamic blood bank to receive and store donated blood, and as long as there is no money charge. Okay, next. So last but not least for this issue, there is a 4th Congress National Fatwa Presiding Committee for Matter Pertaining Islam, and this conference was held at April 1982 regarding the issue of blood donation and the usage of non-Muslim blood for Muslim and vice versa, and the conference decided that the ruling for donation blood is permitted, and it is not necessary to separate the blood of non-Muslim and Muslim. And an appreciation in the form of money is not advisable. Okay. So I'll pass to my colleague for the third case scenario.
Assalamualaikum. My name is Muhammad. My name is Smith. We discussion regarding third case scenario. A patient suddenly recently diagnosed with stage 4 colorectal carcinoma. The patient doctor come to asking you, about this diagnosis, will you explain to the doctor about his father's disease? How will you respond? Next. Allah SWT say very Allah comments that you should render back the trust to those who they are due. Surah Nisa. So the verse highlights the importance of handling regarding so handling and trust the information responsibly. Next, first introduction regarding context and ethical principle. In the medical field, patient confidentiality is a fundamental ethical obligation. So this principle ensures that sensitive information shared by patient is kept private, fostering trust and encouraging full disclosure necessary for effective treatment. Sharia perspective on confidentiality and disclosure. So confidentiality is highly valued with strong emphasis on protecting individual dignity and privacy. So according to Islamic teaching, unauthorized disclosure of private information is prohibited. However, exception exists when disclosure is served a greater good or prevents significant harm, as related by the hadith about disclosure of major sins, for example, murder, adultery, theft, to prevent harm. Next. So regarding this case scenario, first I'll be taking patient consent. First step, always seek patient's consent before disclosing their medical condition to anyone, including immediate family members. So if a patient consent to informing their family about their stage 4 cancer, the healthcare provider can ethically and legally share this information with the family. Regarding if a patient incapacity of best interest, if patient is unconscious, mentally incapacitated, or otherwise unstable to provide consent, the healthcare provider may need to disclose this condition to the family for decision-making purpose, as wielding the information could cause significant harm to the patient or impede necessary medical or supportive interventions. So for this, disclosure may be justified. Next. So Isra verse unfulfill the covenant. Indeed, the covenant will be questions about. This verse underline importance of fulfilling contracts and covenant, which include maintaining confidentiality and as part of medical professional ethical duties. Next, religious justifications and limits. Hadith from Prophet Muhammad, peace be upon him, said discreet omitting of trust at 73 cases may involve illegal shedding of blood, illegal sexual relation, or illegal acquisition of head. So Sharia compliant in Sharia, disclosures should align with the principle of preventing harm and achieving a greater benefit. If informing the family is necessary to ensure patient receive comprehensive care and support, it can be justified. Next. Communication approach, sensitive disclosure. When disclosing such sensitive information, it is essential to do so with compassion and care. The healthcare provider should prepare to offer emotional support and answer any questions the family might have. So privacy and respect, the conversation should be conducted in a private setting, respecting the dignity of the patient and emotions of the family members. That's all for group.
Okay, thank you. Thank you very much for the group 5 for the presentation. So I'd like to invite Prof. Razak for any question or discussion.
Okay, currently Brother Sharir, I don't have any comment.
Okay, Prof. Ibrahim?
Yeah, it's okay. I believe this is the most related cases to the clinical issues. So we advise medical doctors to recognize they need to take patient as maximum level, not to be directed by some patients to violate what we call protocols of the meetings and so on. Because when you deal with a patient is patient, you know. So you need to be aware of this case. So you need to maximize your patient. And the hikmah, which our previous group mentioned, I think coming here very highly. And always you should remember that A medical doctor, when deal with a patient, usually has no any limit. Either it is cultural, or either it is. What I want to say here is you deal with a human being. Human being as human being. Of course, you respect the differences because that is one of the major issues, how you make the patient respect you. But still you are dealing with a patient as human being. So human being has good and negative behavior are always there. So I think that is very important. And the Syrian mention also very good. So I think it's okay. The group mentioned good things.
Thank you, Prof. Ibrahim. Dr. Nazmus, any question or any info, comment?
So far it's okay. Thank you. No comment.
Okay. Okay, thank you very much for our expert panels. So thank you again to the group 5 for the presentation regarding these issues. So we go to our last groups, group 6. And group 6 will cover about wudu and tayammum. And also there's some case scenarios. So I'd like to invite group 6 for to present the case and also the wudu and tayammum.
Yeah, Assalamualaikum. I'm Nawars. I'm going to be a representative for Group 6 under supervision of Dr. Muhammad Sharir. Basically, our topic for today will be wudu and tayammum. So first, wudu is basically an Arabic term which originates from the word wada'ah. It is an Arabic term for ablution, which literally means beautify and brilliance. And from the perspective of Shara, it is the action of using water on certain body parts with the intention of ablution. And it is named as so for the actions that will beautify and make brilliant by cleansing and washing them. From Fiqh al-Mahaji, the word wadu is the name of the water used during ablution, while wudu is the action of the ablution itself. So why we do wudu? It is part of a spiritual cleansing before we do various acts of like salat, where it is not a merely physical act of washing the body parts. The act itself is believed to purify a person's heart, minds, and soul in addition to their physical body. Wudu is also seen as a symbolic act of purifying oneself from sins and spiritual impurities. There's a hadith where the scholars interpret that the reference of every evil leaving with the water as a metaphorical expression, suggesting that the act of wudu serves as a means of seeking forgiveness and removing the negative effects of sins. With wudu also, with the proper intention and consciousness during wudu, this an act of worship that can be done sincerely for the sake of Allah. And with every wudu, it is a renewal of our intention prior to every salah. And it is an opportunity for a Muslim to pause, reflect, and remember Allah before engaging in acts of worship. So it's also a reminder for the need of spiritual cleanliness and the constant striving to purify oneself from sins. So in the Quran, it is prescribed in the Quran about wudu in Surah Al-Ma'idah verse 6 about wudu, as well as in the hadith as well, where Abu Hurairah narrated that Rasulullah said, when a Muslim or a believer performing wudu, washing his face, every evil that he looked at with his eyes leave with the water. And when he washes his hands, every evil he did with his hands leave with the water until he becomes free of sins. So when is wudu required? It is obligatory in various situations. Foremost is before we perform our salah, before we perform our daily prayers, before tawaf, which is basically what we did during the pilgrimage to the Mecca. That is circumambulation around the Kaaba, and also before touching the Quran. So in wudu, we have the obligations and also sunnah parts, where the obligations, if you don't do it, then the wudu itself is considered invalid. As per Shafi'i school of thoughts, first we have making intention, whereby intention is to intend something simultaneously with the action. So we don't really have to say the niyyah verbally. It is considered enough to have the intention within the heart. And then washing the face, where we cover from top of forehead till the end of the chin. washing the hands up till the forearm until the elbow, and then wiping the head from the fringe of the hair to the back of the hairline, and then washing the feet until the level of ankle. And we need to tertib, which means doing it in order. And this each obligatory step, we did it in order and without any big breaks in between. So we have sunnahs of wudu, where we have to say Bismillah in the beginning, we can face the Qibla. Sunnah basically is recommended to do, but it's not compulsory. If we do it, we'll get rewards for it. Then we can, after washing the hands, to rinse 3 times, rinse the mouth. We can do miswak or similar objects to cleanse one teeth, sniffing up water, washing the ears, repeating more than once, the act of wiping the water to the organs of wudu up to 3 times. And we can start with the right side before the left. And lastly, supplication after wudu. So this is basically a summary. The intention: wash hands, rinse mouth, rinse nose, wash face, wash right arm, wash left arm, and then you can wipe hair, wipe ears, and lastly, wash the foot. So nullification of wudu, or what made wudu to be invalid: anything that exits from the private parts, then loss of intellect, that is the loss of ability to distinguish, either through deep sleep or other causes such as drunkenness or insanity, skin-to-skin contact between an adult non-mahram, male and female without any barrier, and touching the private parts of human. So tayammum is basically dry ablution, which is performed in absence of water during journey or in situations where one is unable to touch water due to illness, or in getting water, we can encounter danger. So this is performed by using pure surface earth, or that is any substance on the earth surface such as soil, sand, and stones or salt deposit that is clean and pure. So again, tayammum is mentioned in the Quran in Surah An-Nisa, verse 43. And also it is also mentioned in hadith related by Abu Umamah. So there are conditions and prerequisites of tayammum cited from Al-Fiqh al-Manhaj. Conditions for tayammum is that we must be certain of the time for prayer. And if the time of the prayer begins, we try to find water and we cannot find any water, then we can perform tayammum using dust that is pure. And we must get rid of the najis first and determine the qiblat before tayammum. So for prerequisite for tayammum, similar to wudu itself, we need to have niyat. And the place of niyat is in the heart, and not obligatory to recite the niyat. And then we need to dust face and both hands to the elbows, patting 2 times, as per the hadith of the Prophet, where he explains how to perform tayammum, which I will explain later on, the order of tayammum. And again, the last part is or in the order. So it's similar to wudu as well. So this is the steps. These are the steps of performing tayammum. So the first one is the intention of having to do tayammum, and then we hit both palms on the ground for the first time and lightly shake anything that clings to our palms, and then first wipe our face with dust, same as motion as wudu, and then we remove the dust after being used, and then hit both hands on the ground second time. So then we again remove any dust that cling to the palms and then wipe the dorsal part of our hands using the surface of 4 fingers beside the thumbs from tip of finger to the elbow. And then from the elbow, we go to the palmar surface of the hand, and from the elbow towards the tip of the fingers, and then we cover our thumb as well. And then we can repeat the same movement on the left side. So for tayammum, only for once is enough. Nullification of tayammum is with the presence of water, and everything that nullifies the ablution or the wudu will nullify the tayammum. But if a person prays after performing tayammum and finds water, he does not need to repeat his prayer even if there is time left to do so. So difference, the wudu and tayammum are basically both are Islamic purification rituals, and they differ in its execution and circumstances, where the medium of the wudu is a pure clean water, and the tayammum is clean soil, dust-based. when there is not available, when water is not available, or using water will harm the person. And then the steps, again, the steps for wudu is more than tayammum. Yeah. So for the case scenario, you had a patient, your patient had an open wound and is currently bandaged over his forearm. He asks you whether he can take ablution or not. How can he perform it? In this scenario, it is not stated whether the patient can walk or not. So we assume patient is mobile. So yes, he can perform wudu. But some part of the organ of wudu is bandage. That is the forearm. So, and he is required to keep it away from water. So certain modification are required. So he can still perform wudu. He can still wash his face, use the hands. If the use of hands are limited due to the injury, he may opt the use of water spray. And then the parts that of his arm that is exposed can still be wiped with water. But the one that is covered with bandage, he can wipe the bandage with water. But if it brings harm to the patient, this step can be skipped. And then he can complete his wudu. As per Ustad Abdul Rahman said, explained just now, there are the two ways where the two school of thoughts where he does not need to repeat the prayers after the bandage is removed, and another one is need to repeat the prayers or qada out the prayers after the bandage is removed or become healthy. And again, encourage patient to do easier way and give them freedom to choose whatever scholar opinion if they have their stand. I think that's all from me. These are our references.
Okay, thank you very much. Group 6. So I'd like to invite Dr. Nazmus. Okay, any question or some input regarding this?
No, it's a comprehensive one. Thank you.
Okay.
No comments.
Thank you, Dr. Nazmus. Pak Ibrahim?
Of course, this is late afternoon. We are a little bit sleepy and
Last, this is a last group.
the group, yeah, group is lucky, so we have no energy to put the questions. But I think the scenario of wudu, not wudu really, but wudu and also tayammum. These are the most practical questions arise during the being patient. So I advise our young medical doctor to study this. Last time I am saying that in Malaysia, usually the people unable to learn what we call tayammum, it's simply because there is a lot of water there. If you in Saudi or in some desert countries, usually tayammum is the most important thing there because you are missing water almost time. But here in Malaysia, you know tayammum only when you go to hospital. You know, I'm sure if I bring two people from just layman and then I ask them about the tayammum to describe as our sister mentioned, usually they don't know because they never practice. But as you are medical doctors, firstly you need to learn you yourself ahkam tayammum and ahkam wudu during being patient. Okay. And I'm sure that is one of the most important credit of your Kulliyyah of Medicine here to make our medical doctors to take care of the patient comprehensively. Okay, they satisfy all their religions, not only the medical but also for religious requirements. And sometimes actually they maybe forget to perform their ibadah also. So you need to remind them salah time, how to perform the proper way, purification to perform their salah. So you should be the not only medical but also imam there. Mufti, you are Mufti and also you are medical doctor. Of course, that is very important. So thank you very much. I think all group are well done. And the group number last one, very practical one. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Razak, any input?
I think, currently I don't have much to add. I enjoyed, the presentation. Yeah, nothing to add.
Okay. Okay, thank you very much for our expert panels, Dr. Nazmus, Dr. Prof. Ibrahim, and Prof. Razak for your sharing and also question to our session for this afternoon. So thank you, Group 6, for the presentation. So thank you for all for today's session. So for tomorrow, inshallah, we have the 8th for registration. At 8:30, we have a first lecture with Prof. Amin. And then we will continue our presentation for the Group 7 and other. So once again, Dr. Saiful, any announcement?
Assalamualaikum, and thank you very much to Shahri and to all speakers and also participants and presenters. I just would like to remind everyone to click on the attendance link, Google form in the chat box. We're not going to receive any response after 4:30, so hope everyone can fill in the attendance form. And inshallah, tomorrow we're going to start at 8:30 as mentioned just now by Dr. Shahri. Thank you very much, Dr. Shahri and everyone.
Okay, thank you very much. Okay, so we ended our session with tasbih kifarah and surah al-asr. Subhanakallah. Assalamualaikum warahmatullahi taala wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi.
Waalaikumsalam warahmatullahi.